So we're going to take a look at a way to assess somebody's toe touch or total trunk flexion today. So what we're going to have is Christopher's going to bring his feet all the way together. And from here, what we're going to cue Christopher to do is to just bend over and touch his toes. I'm not going to give him any cues. He's going to do it just as is. So when we are looking at total trunk flexion, we want to consider a few different parts in this movement. We want to see, one, how well the lumbar spine is going to flex or bend. We also want to see how the pelvis and the hips flex and bend in relation to each other here. So as Christopher is to kind of move through this movement, we can kind of get a gauge on where maybe he is good and where he's missing some degrees of movement. So let's try a couple more repetitions. And during assessment as well, it's going to be important to be able to watch and see how movement changes. Does Christopher's toe touch get better as he does repetitions? Does it get worse? Is there pain? Does it feel better? And so as we go along, we actually see Chris's toe touch gets better, and we see that he's getting nice total flexion of the lumbar spine. We'll go one more time. And that we actually see too that he gets good flexion of his pelvis over his hip. If we were to find that there were deficits in, say, the lumbar spine flexion or the flexion of the pelvis over the hip, we would start to find some breakout exercises that we can do to remedy this. Some common faults, some things that I'm looking for when we're taking a look at the toe touch is where we're having deficits. Is it coming from the lumbar spine? Is it coming from the pelvis and hips? So what we'll often see if somebody's missing lumbar spine flexion range of motion, it's going to look a lot like a Romanian deadlift or a straight leg deadlift. So Christopher can demonstrate that. You'll see the weight, the hips shift backwards. However, there's no bend coming out of the low back for this movement here. So while it is immaculate Romanian deadlift form, we are missing some lumbar spine flexion. We would try out some ideas to facilitate that bend. In other cases, we'll see a deficit in the pelvic flexion, or you might know it as an anterior pelvic tilt, and that movement's relation over the hips as well. So what that will tend to look like is as Christopher bends to touch his toes, you'll find that everything starts to round really well here, but there is no weight shift backwards. There is no closing of the angle from the pelvis to the hip itself. And so he's barely able to get his hands to his knees in this case here. So then in this case, we'll start to facilitate some ideas to allow for pelvic flexion or some different hip flexion exercises too. So in cases with low back pain and people are experiencing deficits around their ability to toe touch or bend over to pick stuff up off the floor, or if they're having some difficulties with prolonged sitting, an exercise that I like to incorporate is the Jefferson Curl, which is a segmental flexion of the spine towards the ground. So it's a really nice way for us to target eccentric strength or strength under length of our big back extensor muscle groups. It's a common misconception that this is a trunk flexion ab exercise, when in theory we're standing, gravity is kind of pulling us towards the ground, so those back extensors are going to work hard at the bottom of our movement and then initiate the movement as we go to stand back up. So Christopher's going to have his feet about hip width apart. He's going to have his hands on his thighs, and he's going to imagine himself kind of folding over one vertebrae at a time towards the ground. And as he moves through this movement, he's allowing himself to kind of relax into the bottom. We're creating a lot of length around the lumbar spine. And as he goes to stand up, I like to cue people to think about the glute squeeze as well. This is a way for us to extend the pelvis as well as extend the low back. And he completes the repetition there. Tempo, sets, repetitions vary. I prefer a slower tempo to allow people the opportunity to spend a little bit more time under tension or to get comfortable with some deeper holds. Now, if things are looking good, we can look at progressions. Say Christopher's toe touch is really looking great. We can have him come up onto a step and allow him to explore even more range of motion beyond what his body weight or what his positions on the ground look like. So his hands travel past his toes and start to go down the step a little bit. As you see, this facilitates even a little bit more flexion of the lumbar spine, and then he'll begin to stand back up with that there, doing a great job of coming up into the starting position. And if things are feeling good, he's feeling safe, we can start to give him some weight and have him practice the same idea as well. Thinking one segment at a time, flexing over. Excellent. And then as he comes back up, we're squeezing the glutes, one vertebrae at a time. Some common faults we might see when we start to add weight and progress this exercise is that people resume Romanian deadlifting instead of Jefferson curling. So common thing that we'll see with this is a lack of coordination of trunk flexion. If we continue to see something like this, we'll want to find ways to regress this movement, whether it's less weight, less range of motion, or even moving this exercise to the wall to allow for better coordination prior to adding weight.